On behalf of my co-authors, I want to thank the organizers for the honor of presenting our abstract entitled The Impact of Investigational Purified Microbiome Therapeutic HRQoL on Health-Related Quality of Life, HRQoL, of patients with recurrent Clostridioides difficile infection, RCDI, in ICOSPOR 3, a placebo-controlled clinical trial. And here are the disclosures. Clostridioides difficile infection, CDI, and especially recurrent CDI, has been shown to have a significant impact on patients' physical, psychological, social, professional, and financial status. HRQoL, an investigational oral microbiome therapeutic of purified bacterial spores, was designed to reduce CDI recurrence. ICOSPOR 3, a phase 3 double-blind randomized trial, demonstrated the superiority of HRQoL compared to placebo in the reduction of rates of CDI recurrence at week 8, the primary endpoint. The observed safety profile of HRQoL was comparable to placebo. However, whether HRQoL also improves health-related quality of life, HRQoL, is unknown. HRQoL was an exploratory endpoint in the ICOSPOR 3 trial. Herein, we present a preliminary analysis of these data. ICOSPOR 3 is a double-blind, placebo-controlled phase 3 trial of HRQoL for recurrent CDI. 281 patients were screened and 182 toxin-positive adult subjects with symptom resolution on standard of care antibiotics were randomized. HRQoL, or placebo, was dosed after 10 ounces of magnesium citrate, which was administered to minimize any residual antibiotic that might kill the live drug product of HRQoL. Patients were randomized to 4 capsules of HRQoL or matching placebo, administered daily for 3 consecutive days. The primary efficacy endpoint was CDI recurrence rate at week 8, defined as recurrent C. difficile toxin-positive diarrhea requiring treatment. CDI recurrence at 24 weeks was a secondary efficacy endpoint. Safety was evaluated up to 24 weeks after dosing. Importantly, toxin testing was required at study entry and at suspected recurrence to ensure enrollment of patients with active disease and accurate assessment of the endpoint. Additionally, all subjects had acute infection and no chronic suppressive antibiotics were allowed. HRQoL achieved the primary endpoint of superiority in the overall population with a significant reduction of CDI recurrence compared to placebo at 8 weeks of follow-up. Specifically, HRQoL reduced recurrence rates to 12.4% from 39.8%, with a p-value of less than 0.001 and a relative risk reduction of 68%. The number needed to treat, or NNT, for HRQoL was 3.6. Now, the objective of this analysis was to evaluate the impact of HRQoL versus placebo on HRQoL using a disease-specific measure, the CDIF-32. The EQ-5D-5L measure is a general measure used across a wide population of respondents and measures 5 health domains, which include mobility, self-care, activities, pain and discomfort, and anxiety and depression. The EQ-5D-5L was used to benchmark patients in ICOSPOR 3 with the general population and to help validate the CDIF-32. The EQ-5D-5L measure was used for baseline evaluation. The CDIF-32 is a disease-specific measure which included content applicable to CDI patients and measures 3 health domains, which include physical, mental, and social. Physical domain included physical general and physical specific subdomains. Mental domain included future anxiety and current anxiety subdomains. And the CDIF-32 was used as the primary outcome measure. To understand the differences between the measures, we've abstracted sample questions that relate to the anxiety and depression questions in the EQ-5D-5L measure and the mental health questions in the CDIF-32 measure. Questions from the CDIF-32 measure are specific to patients with C. difficile infection. HRQoL data was collected in ICOSPOR 3 as an exploratory endpoint. Patients completed EQ-5D-5L and CDIF-32 measures at day 1, week 1, week 8, and at recurrence or early termination. Changes from baseline were assessed between SER-109 and placebo and by clinical outcome, so recurrence versus non-recurrence, in the ITT population and within each treatment arm. The between treatment group comparison analysis controlled for age, gender, prior antibiotics, and number of prior CDI episodes. As for demographics, age, antibiotic use, and number of prior episodes were similar across treatment arms. More than half of the overall population were over 65 years of age. There were significantly more females in the SER-109 arm, which is notable because female sex is a risk factor for recurrence. Roughly 3/4 of subjects were treated with vancomycin prior to randomization. 60% of subjects had a history of 2 recurrences before entering their 3rd acute episode, and 40% of the patient population had 3 or more recurrences. We analyzed 159 surveys in this preliminary analysis. We evaluated ECOSPOR-3 patients' general health status as compared to the EQ-5D-5L VAS norm. At baseline, patients in the study had a general health status between good and fair compared to the norm. As expected, we did not observe EQ-5D-5L differences between groups at follow-up due to the lack of sensitivity of a general HRQoL measure. We also evaluated baseline CDF32 scores by treatment group. Baseline HRQoL with CDF32 was found to be comparable when comparing SER-109 patients with placebo patients. We evaluated CDF32 change from baseline by treatment group. We found that regardless of treatment group, all patients achieved significant improvement from baseline on all CDF32 domains by week 8, with a greater magnitude of change observed in the SER-109 group. In addition, we evaluated CDF32 changes by recurrent status. We found that when compared with recurrent patients, non-recurrent patients had significant improvements from baseline in all CDF32 domains at week 1 and week 8, regardless of treatment arm. We evaluated C. diff domains in placebo and SER-109 patients with recurrence and non-recurrence. Not surprisingly, patients with non-recurrence in both the placebo and SER-109 groups had significant improvements in all domains. Notably, however, we observed an improvement in the overall and mental domains, even amongst those patients who experienced recurrence on SER-109. Within the mental domain, we also noted significant improvements in future and current mental anxiety. So in conclusion, significant disease-specific HRQoL improvements are associated with CDI non-recurrence, which highlights the negative impact of our CDI on patients. SER-109 was associated with improved overall and mental health scores compared to baseline, regardless of clinical outcome as measured by the CDF32. In light of emerging data on the potential impact of the gut microbiome on neurologic diseases, future studies should evaluate whether SER-109 may provide mood and anxiety enhancing properties through modulation of the gut-brain axis. Here are the references included in this presentation. And we're also grateful to the patients and investigators who participated in the ECOSPOR-3 trial. Thank you for your time.